Dr. Elena Poulos.
I'm Dr. Marnie Fisher.
And we're here today to talk about laser skin resurfacing.
Laser skin resurfacing has many adjectives to describe. Ablative, non-ablative, fractionated, full field. It gets overwhelming with the details.
There's so many different lasers and it can be so confusing being able to ferret out what works, what doesn't work, what is it really all about. So today we're going to do a deep dive into the different options, really help to explain what the differences are between the different classes of resurfacing lasers, what one can expect from these treatments, and hopefully make some sense of this very confusing topic.
So if you've ever been wondering, is laser resurfacing right for you, we're going to give you all the tips and tools to help make that decision.
So let's start. What is laser resurfacing?
Well, laser is a class of energy-based devices, and they interact biologically with our skin, the tissue, in certain ways, and we use those parameters of the energy transfer to obliterate the skin, poke at the skin, heat the skin.
Right. So when we talk about resurfacing in particular, so these lasers have been designed either to completely ablate, which means to really kill it, or to heat and denature the tissue. Imagine like little packets of energy that are delivered to the skin at various depths. And so different devices have been engineered in different ways. And also the settings really determine A, how much energy gets delivered, and B, what the depth is that's involved, and see what exactly is happening to those tissues. So is it completely ablating it and killing it, or is it just heating it and altering those tissues? So when we're talking about resurfacing, that's in a nutshell what we're talking about, is that the laser, it's a packet of energy which is either destroying or modifying the tissues, either superficially, moderately, or very deeply into your skin. And then that stimulates a healing process whereby we get new collagen, new elastin, we improve the structure, the function, and then overall the health of the skin.
So there's a lot of talk about laser resurfacing. Who is it for? What are the indications that we so promote laser resurfacing for?
So really, resurfacing is used for a variety of, let's say, different categories or diagnoses. So it's excellent for anybody who's looking at improving wrinkling or skin tone. It's excellent for people that have scarring. So whether it's acne scarring or scars from trauma or from surgery. It's also excellent for people that have had a lot of sun damage or have other irregularities in the tone and the texture of their skin. So really it treats a very large variety of different concerns. As dermatologists, as we're making the assessment, we're really looking at really what is the concern, what's going to be the most effective, the safest, and the easiest strategy to address those concerns.
Let's not forget also that you may not have a particular indication. You might have some great tone in your skin, some great texture, and you just want to use laser resurfacing as a prejuvenating effect of the skin. It is an excellent prejuvenation to boost the collagen, so it really is indicated for just about anybody.
Yeah, that's actually a really excellent point. And we love our analogies. So think about it as somebody who might be approaching middle age and you want to start doing weightlifting and maintain the integrity of your muscles before you lose your muscular strength. So in this context for prejuvenation of the skin, we're using the lasers to help continue on with healthy collagen and healthy elastin formation as we're going through the aging process. So what are the different types of resurfacing lasers and what are the considerations when we're making these decisions?
So broadly speaking, there are two considerations, which is ablative and non-ablative. Ablative means the amount of energy and the target, they pair together and the tissue is obliterated. I like to have a visual of, say, a cartoon where a cartoon character points the laser and something literally disappears. There's a bit of a explosive bursting type of a disintegration of the tissue. And non-ablative means that there is a little bit more damage that is heat generated, and it's more almost like of a coring type of treatment. And the depth can be quite remarkably deep and then customized for the different areas of skin. Say skin on the eyelids, skin on the cheek, skin on the body. All of these pieces of tissue, the epidermis and the dermis together, have different depths that are very important to consider when using both ablative and non-ablative modalities.
So think about it, in the ablative mode, we're actually eliminating the tissue. In the non-ablative mode, we're modifying and heating the tissue. So the tissue is still there, but it's been heated. And then there's another category of what we call hybrid lasers. So that's ablative and non-ablative within the same treatment. So there are very few of these hybrid lasers that are combining both ablative and non-ablative within the same pass.
That sounds like the best thing ever.
It is. And then you might ask, so then why do we have these two classes? Why do we have ablative and then non-ablative and then we have these hybrids? And the reason is that there's really advantages and disadvantages to each. So with ablative, because we're eliminating the tissue, the results can be very dramatic. So you can get huge improvement, but the downtime can be a little bit harder, so it can take a little longer. There can be some bleeding and crusting, a little bit of redness that can be prolonged. Whereas with non-ablative, because the tissue is actually still remaining in sight, the healing tends to be a lot faster. So patient considerations and what somebody can actually fit into their lifestyle really weighs into that decision. Enter in the hybrid lasers, and really that's why they were developed and engineered, to try to combine the best of both worlds. So something that's going to give you a faster dramatic response, but make it a little bit easier with the downtime.
And of course, like a lot of options these days, you can have wiggle room on how much the ablative, how close together those energy packets are placed, how deep, how wide those energy packets are, and we're talking microns. So 1/10 of a millimeter difference in this wiggle room of the parameters of the settings on the laser. So it's very important to work with a very experienced and qualified laser deliverer and somebody who really understands your own tissue type, the depth, the quality, and then set those parameters for the results that we're expecting.
Exactly. So getting back to our gym analogy, just to make it easier to understand, if you don't need to be lifting extremely heavy weights, why would you? You might injure yourself. So the whole idea is understanding what the needs are and knowing how to set parameters on these treatments so that you get everything that you want without extra.
I've heard mentioned the word fractionated, and the word gets thrown a lot around, and it's a confusing concept to understand. But what is fractionated versus a full field treatment in the world of lasers?
So fractionated, these little packets of energy and light are hit in microscopic zones. So we have ablation or non-ablation, but the injury is there in a non-continuous way. So we imagine there's certain spots that are hit, and then the parts in between are left untouched. So my favorite analogy is if you think about the aerator machines that they use on the lawns at the golf course, they punch tiny little holes into the grass, but they leave the rest of the grass untouched. So you're getting targeted focal areas of injury and stimulation while leaving the surrounding skin untouched. In contrast to that, the full field treatment is where the entire surface of the skin is treated. So back to the analogy, it's like a lawnmower rather than the aerator. So it's the entire surface of the skin is treated. And again, there's pros and cons to both approaches, hence why we have these different modalities. Each one has got its strength. So in a full field and total resurfacing, basically the entire surface of the skin is treated. The results, again, very, very dramatic, very fast improvement seen, but the downtime is a little bit longer. In the fractionated modality, because we're leaving areas of skin that are not treated, the healing is much faster. Now, the flip side is because you're not treating the entire surface at the same time, usually multiple treatments are required. So again, it requires some thought into what people can fit into their lifestyle and really what their goals and their expectations are.
One of the most important considerations for choosing fractionated versus full field, not only downtime, but there is an inherent risk with full field. So if you think about an entire continuous zone of skin that is treated and removed, there is that much more risk potential for infection or one of the complications of lasers, and it should not be overlooked, definitely. So working with a very experienced and qualified laser practitioner, we often call full field laser treatment laser surgery because it is that impactful and potentially, has some complications that need to be addressed by a qualified medical practitioner.
Yeah. So it's definitely very impactful, amazing results, like very impressive and rapid results, but it has to be in the right patient with the right expectations. So understanding that the downtime is there, pre and post care are very important.
The good news is that when there is a complete understanding of what fractionated and full field, ablative, and non-ablative technology can do for the skin, well-qualified and experienced laser care deliverers can provide all of the above with the right equipment to the zones of the face and the body. So for example, we might choose a full field ablative treatment, say on an eyelid or the perioral area, and a more fractionated approach to, say, the neck or the face. Or we might do the opposite, depending on what the indications are and the need and the targets that we are targeting.
Exactly. I mean, and it really comes down to the fact that every individual has individual needs, and these treatments can absolutely be tailored according to the needs. So where we need something that's a bit more impactful, we can go to our stronger treatments like fully ablative, fractionated or non-fractionated, and where the skin is already in great shape or healthier and it doesn't really need anything, we can do a much lighter treatment in those areas. So let's talk a little bit about the different types of resurfacing lasers. So there's two major types, one that uses CO2 as the energy source, and the second, which is the erbium.
So an erbium laser is at 2940 nanometers, and the CO2 laser fires at 10,600 nanometers, which really does not really impact the layperson, and it should not impact. What should impact the layperson is the target water is 10 times hit preferentially by erbium compared to CO2. And basically, in a nutshell, what that means is that all that energy coming from the erbium hits the water and it is absorbed, and you have a water burst phenomenon. And then a lot of the extra energy dissipates. In a CO2 laser, the energy comes in, hits the water, and it absorbs some of that water, certainly, and a lot of the extra energy then goes into a radiative zone around the target, and then you have basically a coagulation zone. The question is, why do we like and prefer erbium over CO2? What does that mean to you, the patient, the recipient of this laser device?
One of the reasons that Marnie and I prefer the erbium laser is that, again, getting back to the specificity of that particular wavelength target to tissue, we find that with erbium, we can be very precise with our treatments. So particularly certain machines like the Sciton erbium, it's really one of the only resurfacing lasers that exists that you can actually dial on the machine how deep you want that target to hit. So most other lasers, including CO2, yes, you can control the machine in terms of intensity, low, medium, high, but you can't really be so specific to know how deep you're going into the tissue. And when we're talking about resurfacing, that really is a key differentiating fact. So we'll show you in one of our patient demos how we use the ablative technology in tissues, let's say around the eyelid. So we like to measure that skin to know exactly how deep it is. And with that Sciton erbium, we have the power to actually dial in that laser so we know exactly how deep we're going. You don't want to be too shallow because then you might not get the benefit you're looking for. But if you go too deep, then you're putting yourself at risk for scarring and other unwanted effects. So erbium, because it's such a specific target and really targets just water, we know that we're not going to get a lot of collateral damage. Whereas with CO2, again, because there's this broader heat that radiates out from the target, we know that there's a lot more collateral damage, which is not as well controlled by the person performing the treatments.
One of the remarkable findings of great CO2 full field ablative treatments from, say, the late 90s into the 2000s was there was a large amount of residual pinkness in the skin that stayed for months, 3 months, 6 months, and sometimes it was a little bit permanent.
Yeah.
So you take your CO2 laser and do 1 pass, 2 pass, 3 passes to get down to those deep upper lip wrinkles, the acne scarring, and the skin did smooth out, but sometimes it had a funny kind of a pink hue that was almost a little unnatural.
And a waxy look.
And a waxy look to it, yes. So that's one of the effects of too much coagulation when it hits the skin.
Well, and then we can actually talk about that. So one of the things that people that like CO2, one of the things they talk about is the fact that all this heat that the CO2 generates causes this immediate tissue contraction. And that's true. So you can watch a CO2 laser being performed and you can visibly see with your eye that there's this immediate contraction that happens, which is from the immediate heating of the tissues. However, when that's looked at more closely, most people will agree that that immediate contraction is in fact only temporary. And over time, so let's say after 1, 2, 3 weeks, that immediate tissue tightening that's seen from the heating actually does relax and doesn't necessarily give long-lasting tightening of the skin.
It may be a result of just a little bit of instant dehydration in the tissue itself.
Right. Even with the erbium laser, so some erbiums like the Sciton actually has an added feature. So if the provider is actually looking to add more heat and they want that heat in a particular area, there is a setting that is called coagulation that can be added in if they're looking for that added heat to be included in the treatment. But the benefit for us is we can be very, very specific about when it's added and when it's not. So we get it when we want it, but if we're looking to treat an area and we don't want that prolonged redness, that longer healing time, we don't want to risk having that waxy look once the healing is done. You know, that's some of the reasons that we prefer the erbium.
Yeah, so the ProFrac device allows, once again, that customizable, tunable treatment option that can be adjusted even for the same person in different micro regions of the face. So again, a qualified, well-experienced dermatologist or plastic surgeon can identify the different micro regions of the face and then apply the parameters and the tools that are best apt to give the results without side effects in those areas.
So we kind of liken this whole thing, it's again getting back to our analogies, it's like having an amazing sports car and then a professional driver. So you really need both. So you need the machine, so something which is high performance completely, that every aspect of that machine has been engineered to give you exactly what you want and nothing that you don't want. And then you need the driver behind the machine in order to get the best outcome with that particular device.
And not just a driver with a heavy foot.
Exactly. So another big thing to consider is skin types. So of course we all have different skin colors, from the very fairest fair and people with much darker skin tone. So that is an important consideration.
It is incredibly important to understand the potential for maintaining that tone where we want to maintain tone in the skin. So not having a risk of hypopigmentation or hyperpigmentation after the treatment, and just targeting the regenerative and proliferative effects of the epidermal cells and the collagen production in the dermis. So with regard to extra radiative heat that's left behind in the skin, that is quite potentially a large culprit or contributor to the potential for PIH. So we like to just call hyperpigmentation PIH for short. And it is definitely controllable and treatable, but we want to avoid it in the first place. So if we have the ability to tune in those energy packets and the radiative effects into the skin, and then control the density of where the energy packets are hitting the skin, and we understand what that skin type is, then we can get the best outcome for the skin health and the skin quality and maintain the patient's original skin tone, which is very, very important. The Sciton allows us to do that. And we are very comfortable treating, as you say, the fairest of the fair that can tolerate a lot of extra heat, and darker skin types where we want to really rein in that control.
Again, really what's happening there is that the melanocytes that are present in the skin, people with darker skin tones, they have the same number of melanocytes, but the melanocytes are more active. And if there's inflammation within the skin that can be triggered by heat, those melanocytes are stimulated to make more pigment. And that's where post-inflammatory hyperpigmentation comes from. So it is very important, particularly with the darker skin types, that we're cautious and aware of how much heat our lasers are generating in the skin so we can avoid that complication. And again, the Erbium and the Sciton platform, specifically because of that control, allows us to treat those darker skin types while minimizing the risk of PIH.
We have found, after using many lasers for many years, that there are steps to be taken prior a pre-treatment laser consultation with 1 to even 4, maybe even 6 weeks of pre-treatment with skincare can deliver the best laser results. At the time, tunables and parameters of the laser, very important. And then the immediate post-care and the weeks following the care are very important as well. So it is very important to have your treatments from a qualified, experienced laser provider, because these potential complications can be very, very devastating. We don't mean to scare anybody away, but it really is, it is risky with this particular PIH topic.
Yeah, these are basically, they are invasive treatments. It's like doing surgery. Knowing what is being done and that the provider is qualified and has a lot of experience is really critical to the outcome of the treatments.
A lot of our patients and a lot of online media these days are talking crazy CO2 outcomes and benefits, and why all of a sudden is CO2 on the tip of everyone's tongue? I honestly thought it was kind of being put to bed, to be honest. But what is your take on the CO2 think tank happening?
Well, again, there's a lot in social media about CO2, and it seems to be very publicized, and there's a lot of marketing going on behind CO2. And just to remind everybody that just because something is highly marketed or you're seeing a lot there on social media, it doesn't necessarily mean that there's truth to it and that it's actually going to be the best procedure. So I can give an example. So there is sort of this misconception that CO2 is stronger, it's deeper, it's going to give a better result. And that is certainly not the case. So for example, with CO2, we do know actually that the depth can actually be maxed out because of this whole concept of the thermal regulation zone. Whereas with Erbium, again, if somebody has got the right machine and they know how to drive it, there's actually no limit to how deep you can go with that Erbium laser. So it can go beyond the depth that anybody would ever require. So the strength is certainly there with the Erbium. So just a reminder that even though you may be seeing a lot of attention or a certain topic coming up in your social media, it doesn't necessarily mean that there's truth behind it, and also that it's going to be the best treatment for you. So we've alluded a little bit about the differences between fractionated and full field ablative treatments. So let's talk a little bit about the differences, again, in the context of our Erbium and CO2.
Well, the Sciton suite of lasers allows us to choose between a full field with the TRL and fractionated with the ProFrac and the Halo and the Moxie. And we love that customizability for our microzones of the face and the body, and choosing the depth certainly with the decision that we provide for the patient, customizable, individual, for whether we're going to do 1 pass or 2 pass or 3 passes. My understanding with CO2, however, is that today there really isn't a full field CO2 laser on the market. There were some from the late 90s and the early 2000s that were still in use, but they did have risks inherent. In a video that we did, we talked about these risks of residual pinkness that lasted for months or permanently, and a waxy type glow to the skin that was a little bit opaque and has a lot of nice normal texture to the skin. And the CO2 fractionated on the market has limitations with how many passes that can be done, with how deep they can go. And the Erbium allows us to, even with one pass, go as deep as we want. And so the risks are inherently preserved in those treatment decisions.
Exactly. So my understanding is with CO2, again, because of all the excess heat that's generated and perhaps a lack of precision in how deep you go, there's really very few full field treatments being done because the risk of complications were much higher with those older devices. And there's really not a lot actually that are being sold nowadays.
So there's no doubt we like to geek out and talk about the science. There is no doubt. But our preference is Erbium. And what are our favorite machines that we offer to our patients that we love in our clinic?
Well, we've been partners with Sciton now for many, many years. And the reason is that really it's the one company and the suite of lasers that we find we can really trust as far as the way they've been engineered, their performance, their consistency time and time again. And this predictability and the precision really results in providing safe and effective outcomes for our patients. And we've had that experience really across the board with the entire suite of their lasers. So from the strongest of the total resurfacing ablative laser to the ablative Fractional to the non-ablative like the Moxie, which we've had amazing results with, and then with their BBL, which again is a completely different type of laser than what we've just talked about, but it's really the precision and that predictability that allows us to treat our patients and get the outcomes that we're looking for.
Okay, so let's wrap up the laser resurfacing video talk that we are here to provide a little bit of background for people to make wise choices. We think that don't believe the hype. We prefer Erbium over CO2 for the myriad of reasons that are endless. We think safety first all the time with lasers. Experience comes first as well. And if you're looking for indications, tone, texture, wrinkle removing, acne scarring, trauma scarring, prejuvenation, what have I forgotten?
Sun damage.
Sun damage in general. Then Sciton lasers, ablative, non-ablative, fractionated, full field.
And so we find with our Sciton suite of lasers, it really gives us so much flexibility. So for different patients, different skin types, but even for the same patient within one treatment. So again, the total ablative TRL, we can do ablative fractionated with the ProFrac, we can do the hybrid with the Halo, we can do non-ablative fractionated with the Moxie. So there's so many different combinations and so much customizing that can be done to really make these very safe and effective. Okay. So that's a lot of information.
Hopefully you've stuck to the end of the video to hear it all, and you're probably still scratching your head thinking, I don't know what to do.
So at the end of the day, really always, we recommend come in for the consultation. Watching this is going to be very helpful because it'll get your mind thinking about all of the different options and the considerations so that you can put this into context. But really what matters the most is what's right for you. Come in for the consult. We're here to take care of you and to really help you make the best decision.
Thanks for watching, everybody. I'm Dr. Marnie Fisher.
I'm Dr. Elena Poulos. We love seeing your questions, your comments. Please let us know if you have any further follow-up. We'd love to hear from you.
Bye-bye.
Bye.